Have you ever wondered what the sounds of the heart mean? It's not just the rhythm of life, but an intricate symphony of sounds that can tell us a lot about our health. When a doctor places a stethoscope on your chest, they're tuning into the music of your heart, a series of beats and pauses known as heart sounds. These sounds are crucial in diagnosing heart conditions. They're divided into 4 main beats: S1, S2, S3, and S4. Each has a unique role in the heart's cycle, and changes in their rhythm can often signify an underlying issue. Alongside these beats, there are also murmurs, an extra unusual sound that can sometimes be heard. Understanding these sounds, their origins and their implications, is a crucial part of cardiology. It's a fascinating world of rhythm and resonance, of beats and breaths. Ready to dive deeper into the symphony of the heart? Let's begin with the first sound. The first heart sound, or S1, signifies the start of a fascinating journey. S1 is the sound that your heart makes when the mitral and tricuspid valves close. These are the valves that separate the chambers of the heart, ensuring that blood flows in the right direction. Imagine it like a grand doorway closing, marking the commencement of an incredible event. This event, in the case of your heart, is the contraction of the heart muscle or myocardium. As the valves close, the chambers of the heart, the ventricles, are sealed off. This is where the magic happens. The ventricles contract, pumping blood out to the rest of the body. Now, why is this sound so significant? Well, the S1 sound is a useful tool for health professionals. It provides them with valuable information about the rhythm and rate of your heart. If the S1 sound is unusually loud, soft, or split, it can indicate a variety of heart conditions. This could range from issues with the heart valves to problems with the heart muscle itself. So next time you listen to your heart, remember the significance of that first sound. It's more than just a beat. It's the start of a process that sustains life, a process that is fundamental to our survival. Understanding S1 brings us one step closer to unraveling the mysteries of the heart. Now, let's move on to the second sound. The second sound, S2, is where the plot thickens. This sound is a bit of a duet, a harmonious blend of 2 distinct notes. The cause? The closure of the aortic and pulmonary valves. But let's break this down a little further. In the grand performance of the heart, S2 marks the end of systole, the heart's contraction phase, and the beginning of diastole, when the heart takes a brief, yet well-earned rest. The first note in our S2 duet comes from the aortic valve slamming shut, followed closely by the pulmonary valve. The aortic valve closes first due to the higher pressure in the left side of the heart, while the pulmonary valve takes a beat longer, thanks to the lower pressure on the right. But what's truly fascinating is that during inspiration, these 2 sounds can be heard separately, a phenomenon known as splitting. This is due to the fact that during inspiration, the increased return of blood to the right side of the heart delays the closure of the pulmonary valve. So why is understanding S2 so important for cardiovascular health? Well, changes in the timing or quality of S2 can indicate a variety of heart conditions, such as hypertension or heart failure. The detection of these subtle changes in S2 can provide valuable clues to a patient's heart health. With S2, we've reached the halfway point. But there's more to learn. Let's proceed to S3. S3 and S4, while less common, play crucial roles in our heart symphony. Let's start with the third heart sound, or S3. S3 is not typically heard in healthy adults, but it may be normal in children, young adults, and pregnant women. The sound is produced by the rapid deceleration of blood being ejected from the left ventricle into the left atrium, or in other words, rapid filling of the ventricles. When the heart is relaxed and the ventricles are filling with blood, the sudden stop of blood flow can cause a vibration, which we hear as the S3 sound. Now let's consider a scenario. Imagine a large amount of blood rushing into an already filled ventricle. This could happen in conditions like heart failure, where the heart is unable to pump blood efficiently. The extra blood in the ventricle causes it to stretch, and when it can't stretch anymore, it stops the blood flow abruptly, creating a notable S3 sound. So while it can be normal, an S3 sound in an adult may also be an indication of heart disease. On to the fourth heart sound, or S4. Unlike S3, S4 is almost always a sign of an underlying condition. It's the sound of atrial contraction produced when the atria push blood into a stiff or hypertrophic ventricle, a ventricle that's hard to fill. This can be due to conditions like hypertensive heart disease or aortic stenosis. Imagine trying to push a large volume of liquid into a small rigid container. The resistance creates a vibration, and that's the S4 sound. An S4 sound, therefore, is a sign that the heart is working harder to fill the ventricles. a possible indication of conditions like high blood pressure or narrowing of the heart valve. So, S3 and S4, though less common, hold important clues about our cardiovascular health. They remind us that our heart symphony is complex, with each sound playing a vital role. With S3 and S4, we've covered all the basic heart sounds. But what about the extra sounds, the murmurs? Murmurs are like unexpected notes in our heart symphony. Just as a musician may hit an off-key note, sometimes our heart does the same, creating what we call murmurs. These are unusual sounds heard during a heartbeat cycle, often described as a whooshing or swishing. Murmurs can be caused by a variety of factors, such as abnormal blood flow within the heart due to conditions like stenosis or regurgitation. They're categorized into 3 types: systolic, diastolic, and continuous, each with its unique characteristics. Systolic murmurs occur during the heart's contraction phase, while diastolic murmurs are heard when the heart relaxes between beats. Continuous murmurs, on the other hand, persist throughout the entire heartbeat cycle. These murmurs are detected using a stethoscope and can be significant indicators of one's cardiovascular health. While some murmurs are harmless, others may signal underlying heart conditions that require medical attention. This brings us to the end of our journey through the sounds of the heart. Remember, every beat tells a story.